Derita, derita, derita. Stop. Okay. Hop. No le mueva. Asparagus.
Hey guys, what's up? It's Stephanie and welcome back to my channel. So in the video today, I want to discuss my OB-GYN rotation. So my OB-GYN rotation was my second rotation out of the 3 rotations that I had for my first semester of my clinical rotation. ER was my first one, my second one was OB-GYN, and my third one was surgery. So for those of you who are interested in OB-GYN in general, as a physician assistant, or are applying to PA school, or about to have your OB-GYN rotation, I hope this video is helpful for you guys. So I want to start with basically how long are rotations. So rotations are 5 weeks long. That's for my program. Now I know other programs are a little bit longer, sometimes they can be 6 weeks, but in general I think they tend to range between the 5 and 6 week mark. But my program, it's 5 weeks each rotation. So you're required to follow your preceptor Monday through Friday, or even weekends if needed. You're required to follow them wherever they go, whether it's for surgeries or in clinic, you are required to be with them, whether they allow you or not. So my OB-GYN rotation, I have to say that I really enjoyed my OB-GYN rotation out of the 3 rotations I had my first semester. And the interesting thing is that I was very skeptical about my OB-GYN rotation. Honestly, I wasn't very interested in it and I was not looking forward to it. And that's like the first no-no in medicine or as a student in general, is to make sure that you have an open mind and do not start judgment about a rotation because of your past experience, etc. Because then it's not gonna be a good rotation for you if you're just there and you tell yourself, I hate this rotation, I hate this rotation, I hate this rotation. And a huge no not to do is to tell your preceptor that you do not like the rotation you're in. So do not tell your OB-GYN doctor, well, I don't like OB-GYN. No, that's a huge no. You're not going to tell your preceptor. And in regards to grades, so 40% of your grade is going to be your EOR, which is an end of rotation exam. It's usually the last day of your rotation. So it'll usually be on the 5th week, for example, on a Friday. So literally like the last day of rotation. You usually don't go to clinic that day. Usually your last day of clinic will be that Thursday, and then your Friday you'll have your end of rotation exam. Your end of rotation exam, you'll have topics that are about basically whatever the rotation you finished. So in this case, it was OB-GYN. It's usually just OB and GYN related. So you'll have pregnancy questions, questions about the menstrual cycle, etc., pelvic inflammatory disease, etc. Now these exams are made by the PAEA committee. So basically it's these exams are given to all PA programs at a national level. So same exams all other PA programs are getting and are receiving and are taking. Now these exams are really hard for me in comparison to the didactic exams you were taking, because it requires a higher level of critical thinking. So that's 40% of your grade, and then 40% of your other grade is your OSCE. Basically, an OSCE is an exam that you are given. You are given a patient, a simulated patient, and you are required to go into a room, and you'll have a professor be sitting in the room while you are interviewing the patient, and they're grading you on whether you do a proper medical history, an HPI, and a proper physical exam, a proper diagnosis and treatment, and whether you do proper patient education. So they're grading you on all this. So basically give you a complaint. They'll give you a piece of paper that has a chief complaint. Now the chief complaint is usually very vague. It'll be something like abdominal pain, or pain while urinating, or blood in the urine. So something very vague, not something very specific. It'll give you the vitals, so you always make sure you have to check whether they have a temperature, their heart rate, their oxygen levels, and then it'll give you the name of the patient, and then it'll give you the age. Usually for all my patients, actually I had the date of birth, so you had to calculate the age, and sometimes I would forget that because I was just so nervous. So just make sure that you look at the date of birth and that you're able to calculate the age, because this is really important when you're going to go and present your patient to your preceptor. You have to say, I have a 59-year-old female who's complaining of abdominal pain, I have a 65-year-old male who's complaining of chest pain, etc. So you have to make sure that you have the age and also the name of the patient so you can address them. So this is 40% of your grade. So in general, you have your EOR and your OSCE, 80% in total. And then on top of that, you have 10%, which is your preceptor evaluation. Basically, the individual that you are rotating with, whether it's a doctor, a PA, or a nurse practitioner, they will give you an overall grade at the end of the rotation, and this will be 10% of the grade. They'll grade you on whether you were present to their clinic every day, whether you were tardy, and just basically how you performed in general with them. And your other 10% of your grade is going to be, in my program, is that you have quizzes every week. And then on top of that, we also have blogs we have to write. So we write a blog every week, basically on what we saw in clinic that we thought was interesting or something that we were studying. So this is just basically your grade. So that's why it's really important in regards to your preceptor. I know some other programs may weigh the preceptor grade higher, I think maybe even 20%, 30%, or 40%. And this is why it's important that you make sure that you're always on time with your preceptor, you're always prepared, okay? And you are always present. It's really important because these are the things that they're gonna grade you on. And so my doctor, he owned his own clinic. It was just him working by himself in the clinic. He didn't have any nurse practitioners or PAs with him. He saw about 30 to 40 patients a day. So I would be with him Monday through Friday. Mondays, Wednesdays, and Thursdays he had clinic, and then Tuesdays he had clinic also in the morning, but then he had surgeries in the afternoon, and then Fridays he had surgeries. Sometimes he would take one Friday off, but most of the time he had surgeries. And then in between that time, he also had to go see his patients that were in labor, or were delivering, or were just in the hospital for some type of pregnancy complaint. So I would follow him wherever he went. So I would wake up at around 7:30, be at clinic by 8:30, and then at 8:30, the clinic actually opened at 9, but I got there at 8:30 because the medical assistants and the staff would start getting the rooms ready, etc. And I just wanted to make sure that I was there before the first patient came in. So then he would start seeing his patients, he would go in, he did a lot of pelvic exams, and I unfortunately wasn't able to do any of the pelvic exams. Usually OB/GYN doctors are very protective of their patients, which I totally understand. And I wasn't able to do any of the pelvic exams, but I was able to see a lot of pelvic exams, and this actually helped me for my OSCE because we were required to do a pelvic exam. Obviously not on a real patient, but we had like a mannequin, and you were supposed to describe every step that you were doing in the pelvic exam, which was whether you were putting lube on, whether you were opening the whatever you were using, etc. You were just required to explain every step, and when you were obtaining the pap smear and how you are touching the endocervix, the ectocervix, etc. So you're supposed to explain every movement, and being the fact that I saw this doctor do so many of these every day, 5 days a week, I knew how to do this, and I was able to perform this on my OSCE, so it was great. And he saw patients from basically, I would say, probably like 15 to 80 or 90. He did a lot of pap smears, a lot of pelvic exams. He did a lot of cancer sampling, pregnancy patients. I was able to see a lot of ultrasounds, and I really enjoyed it. I saw ultrasounds, whether they were abdominal ultrasounds or transvaginal ultrasounds. It was just a really good experience, and just a really great experience when you see that heartbeat for the first time, when the mother comes in with their significant other, and you see just the happiness in their face to see that first heartbeat, and the fact that you're able to see that heartbeat on that baby is just amazing, and you're able to see the head and the legs on the ultrasound. So I really enjoyed this part of OB/GYN. In general, also another thing is that I was able to scrub in with him for several procedures, whether it was total abdominal hysterectomies, whether it was also first C-sections. I mean, the first time I saw C-section, I was so happy to see just how the doctor was able to take out that baby, and it was just amazing. And also be able to see vaginal deliveries was just also another amazing thing. So I really enjoyed this. Now, when he was at the hospital, there was also some other residents that were there. So the residents were the ones that were able to scrub in for the vaginal deliveries. So I didn't scrub in for those because there was already a lot of people in the room. But when it came down to the surgical surgeries, for example, the transabdominal hysterectomies or the the deliveries of the C-sections. There was also a resident there, but I was able to scrub in and also be able to see the patient, etc. Be born, the baby, etc. It was amazing. I really enjoyed this rotation. One of the things though I have to say is that in PA school, we only had one day, probably like 2 days of scrubbing. They taught us how to scrub from washing your hands, how to move in the OR, and how to not contaminate yourself. But I have to say that I had done this in probably like June or July, and it was October to mid-November when I was rotating with this OB-GYN doctor. Now, this is my fault because I had completely forgotten how to scrub, and I know for certain procedures I didn't know he was gonna have surgery, for example, that day, and it was just like out of the blue. If he had a patient that was in labor, then he would leave clinic during his lunch, go deliver the baby, and then come back and keep seeing his patients. So it's days like that I was just not prepared, and this is blame on me because I should have prepared myself on how to scrub properly and not contaminate. So of course, the first few times I was with him when I went in, I was chewed out, not by him, but by the staff in the OR technicians, because I was not scrubbing in appropriately and I was contaminating everything all over myself and the utensils and everything. It was just really bad. So I was getting chewed out everywhere and I was just so nervous. And it was interesting because my doctor was just like very calm. He didn't chew me out or anything. But then I made it a point that after that, I go and I watch YouTube videos on how to scrub properly, whether it's putting your gown on, whether it's washing your hands, how to maneuver properly. They had taught us this already in PA school, but I had just forgotten about this. So for those of you who are about to do an OB-GYN rotation, a surgery rotation, or anything that just requires you to be in the OR, make sure that you practice on how to scrub appropriately, because some staff will not help you. And the OB-GYN staff were not very nice, so they weren't helping me. They were just screaming at me all the time. Thankfully, after probably like the third time, I finally got it of how to scrub in appropriately without needing anybody else to help me, and I was able to scrub in appropriately. So make sure that you brush up on that. You watch YouTube videos on how to behave in the OR, what not to do in the OR, and how to not contaminate other things in the OR. So this is something I learned, thankfully, because my next rotation was surgery, which was going to be almost all OR. So thankfully I learned this in my OB-GYN rotation. And so yeah, basically that's how my OB-GYN rotation was. We saw women, like I said, from all ages. He also taught me how to read ultrasounds, whether he was looking at the endometrium, how to measure the endometrium, how to see whether, for example, an extensive growth of endometrium was going to be cancerous or benign, depending on how large or the thickness or the diameter or the width of the endometrium was. He taught me also how to read an ultrasound, how to see where the head is, the femur, etc. And I saw a lot of pelvic exams, and I was able to feel very comfortable. Actually, even though I didn't get to perform one, I felt really comfortable on how to perform one because he explained everything he was doing. And just in general, it was a really good experience. Also being able to see a patient that was pregnant and them coming in the next day for their post-op and seeing how you were there to deliver their baby and you're seeing that baby there. It's just the best feeling ever. Being able to see your first C-section, for the doctor being taking that baby out, and also seeing the vaginal deliveries. It was just an amazing experience. I really enjoyed it, and I can see myself doing that in the future. So yeah, that was just basically how my OB-GYN rotation was. So I hope you guys enjoyed this video. So for those of you who are skeptical about your OB-GYN rotation, don't be skeptical about any rotation in general. Who knows, you may like it. Like I said, in this case, I was not looking forward to my OB-GYN rotation at all, and I ended up enjoying it and loving it, and I can see myself doing this in the future as a physician assistant. So I really enjoyed this rotation. Alright guys, thanks for watching my videos, and I'll talk to you guys later. As always, if you guys have a question for me, you can comment below or just send me an email and I'll get back to you guys as soon as I can. Sometimes some of my rotations are really busy, like my surgery rotation, and so sometimes I don't have time to respond. Also for OB-GYN, I want to say that there were certain days where I also got really late. got out really late because there would be times where we were waiting on the patient to, say we had a patient that came in and she was having contractions. Well, the patient needed to dilate a certain amount of centimeters in order to the doctor to deliver her vaginally or a C-section, etc. So sometimes we would be there waiting for the patient to dilate, and sometimes I would get out late, like at 9 or 10 or 11. But that was just basically not that often, 2 days out of the week, 1 day out of the week, sometimes not even any time during the week. And so it just really depended in comparison to my surgery rotation, where I got out late almost every day. And for clinic, usually I got out like at 5:30, 6 the latest on clinic days, but it wasn't that bad at all. I really enjoyed this rotation. Alright guys, thanks for watching my videos, and I'll talk to you guys later. Bye.